Hello, this is Dr. Do again. This video is on alphabetic list problems on letter L. I start with the lung diseases and continue with the lung diseases, and I have talked about the pneumonia, I have talked about the asthma, and talked about the emphysema last time. Today I'm going to talk about another lung disease called pulmonary embolism. Just came to my mind, because it is quite common in older people, or if young people had a risk. So is this any condition associated with this pulmonary embolism need to visit emergency? Definitely it is emergency, could be life-threatening. So the sooner the better. What are the signs you're looking for if there's a pulmonary embolism developed? Usually it's very subtle. The symptoms quite be subtle. May or may not have hypoxia, difficulty breathing, but for those with risk, the risk factor, I'm going to talk about it. For those people with risk factors for this pulmonary embolism, develop the subtle symptoms. Feel dizziness, feel without cause of this dizziness and heartbeat really faster, may or may not have faster breathing, and chest pain, may or may not have it, usually have it, but could absent. So this for those people had the risk factors, suddenly develop this chest pain or and heart rate faster than usual, without cause, without activity. If that's the sign, call your physician. Your physician will guide you. I'll give you idea. Go to the emergency room. The sooner the better, because sometimes at the early stage of this pulmonary embolism, not necessarily have the feel difficulty breathing, but even though the oxygen probably already low, but it's not cannot really manifest as difficulty breathing. So the main signs I look for is, like I said, very subtle: increased heart rate, chest pain, and plus the risk factors, the past medical history, medication history. So what are the, is there anything you can manage at home regarding to this pulmonary embolism? No, definitely no. I think it's very serious condition. I'm going to explain to you about this. What is this pulmonary embolism? What the complications? Let's start with the risk factors. We probably already know. The risk factor for this pulmonary embolism is the falling thrombi from somewhere. Usually it's from the deep venous thrombosis in the lower extremity. And the risk for this deep venous thrombosis, including genetic cause with hypercoagulation state, or taking some medication, for example, the estrogen, increase the risk of the coagulation, increase the in the state of hypercoagulatory state, particularly for those hypolipidemia. On top of that, overweight or long-term immobility, does not move, bedriding, or long time flight. So these are all the risk factors for this deep venous thrombosis. If not identified, if not diagnosed, or if subtle without symptoms, then this thrombosis will fall off at the thrombi to clog the lung. So the signs of deep venous thrombosis on the lower extremity is like this. I think it's, like I said, on top of those histories, long-term immobility, either the bedriding or the long-term traveling, or the hypocoagulation state, the genetic or medication, or over-the-counter or the prescribed medications, and also the hyperlipidemia, diabetes, hypertension, any causes of the increase the viscosity of the blood. They're all the risk factors for this deep venous thrombosis, short-term DVT. So the signs for this DVT are including the swelling of the leg asymmetrically. So the left or right, for example, the right probably is enlarged because swelled, but the left is not. And also you may or may not have this decreased the pulse if you feel the feet on the dorsal part of the feet, you feel the pulse compare. And one of the the extremity, lower extremity, probably have decreased this pulse and feel cool compared to the normal side. So these are the signs or the symptoms for this DVT. If that is the case, it's also emergency, because if not treated in time fashion, those thrombosis might fall off, dislodge, like I said, and then stuck in the lung. A small blood vessel cause the pulmonary embolism. So what is the consequences for this pulmonary embolism? Like I said before, the pulmonary circulated from the pulmonary artery, carry the blood from the right ventricle and full of carbon dioxide, and then in the lung to exchange the oxygen, carbon dioxide, and carry back to the heart by the pulmonary veins. So you know this is the system. So if the pulmonary embolism either stuck in the vein system, venous or arterial system, will cause this pulmonary embolism, infarction of the lung. Like we know the myocardial infarction. This is the pulmonary embolism will cause the infarction in the pathology standpoint if the lung undergoing ischemic. So it's called infarction of the lung and cause the consequence. And then of course associated with that is loss of the alveoli, the function unit. So feel hypoxia, we'll have hypoxemia. Oxygen is not enough for the tissue perfuse and for the blood system. So this is the signs of this and the consequence of this pulmonary embolism. And clinically, I already mentioned, it could be subtle chest pain associated with non-specific elevated heart rate, palpitation. Is not like you doing heavy work or walking stairs, but just when you're sitting there, this palpitation just come up. So that's probably the sign for those who had risks. So in terms of you know the signs, you know the risk factors, and you want to see the physician. And the treatment is really to dissolve those after diagnose and dissolve those thrombi. The sooner the better. And also in terms of diagnosis, usually when there's may or may not have this DVT, deep venous thrombosis, and scan the lung or do the other ABG, blood gas, or any other test image study to identify this thrombosis, embolism, emboli. So this is the term referred to the same idea of the causes of the pulmonary infarction. That's the pulmonary embolism, the consequences of this. So this is about the video regarding to the pulmonary embolism. I brought here because it's quite common in the hospital settings or non-hospital settings. And it could be very serious because of the subtleness. Not like the chest pain, like the cardiac infarction or malinfarction. This is a pulmonary infarction. The symptom is quite subtle, so sometimes it's not easy to identify if without knowing these risk factors, without knowing these signs. So I'm going to stop here. I hope it helps, and I'm going to see you next time. Thank you for watching.